our sterile 19 to 22 gauge and one in needle, and then our screw clamp and our bat blanket. So the goal of this procedure is um, so the assessment is we need to check the patient's record to determine such as the purpose of the closed intermittent irrigation, the physician's order, the type of irrigating solution to be used, the patient, if the patient to receive continuous or intermittent flow into the bladder, the frequency of irrigation, and then the type of the catheter that we will be using. And then next is we need to assess the following. So the color of the urine and the presence of the mucous sediments. If the closed system, we need to know that the fluid is entering the bladder and draining the bladder is proportion. We need to know the amount of fluid remaining in existing irrigating solution catheter. We need to check the irrigation tubing to ensure that it has no kinks and it is open clamp according to the physician's order. Next is we need to review the patient's medical record, including the physician's order, and then review the input and output record. And then next is our planning. We need to develop individualized goals of care for patients based on our nursing diagnosis, such as maintaining the patent free-flowing urinary drainage system, minimize the risk of infection, and then minimize discomfort. Next, we need to collect necessary equipment and supplies. And the next is we need to explain the procedure to the patient. So good day, Mr. Little Cruz. So I am Michelle Cruz, your nurse for today, and I will be performing closed intermittent irrigation. And next is we need to with our implementation, we need to confirm the order for catheter irrigation in the medical record of our patient, and then also we need to bring the necessary equipment in the bedside, and then perform our hand hygiene and put on PPE if indicated, and we need to identify our client. So, good day, I am Michelle Cruz. Can you tell me your name? Okay, so he is Mr. De La Cruz, and the next is we need to close the curtains around and the bed, and then close the door and the windows to provide privacy to our client, and then we need to position we need to adjust the bed to a comfortable working height, which is above the elbow or at the level of the elbow, and then next is we need to put on our gloves and put on our gloves. We need to put on our gloves and then empty the catheter drainage or empty the drainage bag, and measure the amount of our urine. So this is our drainage bag, and this is our metric container, and then we will be collecting the urine, and then we need to note the amount and the characteristic of the urine. And then after that is we will now assist the patient to a comfortable position, which is supine position, and then we will now place a waterproof pad under the patient's thigh, and then also we need to remove the catheter from the device or the tape anchoring the catheter using a alcohol swab. And next is we need to open the supplies using aseptic technique, and then aspirate the prescribed amount of the irrigant. So we will be putting our solution into our sterile container, and we need to aspirate the prescribed amount of our irrigant. So our syringe is 30 to 60 ml, so we will aspirate our irrigant solution, and then next is um, we need to cleanse the access port of our lumen, our catheter. And the next is we will be clamping our tube. And then after clamping our tube, we will be inserting our syringe, and then we will now remove our tubing, our clamp, and then uh, we will also remove the irrigating solution, and then we will be aspirating, or we will instill our solution, and then we will aspirate it again. And then next is we will clamp again our tube, and then next is we will and then next is we will now be we will now we will now and next is we will repeat the procedure as prescribed, and we will now be removing the clamp on the catheter. And then next is no, we will clamp this one. We're going to clamp it. And then next is unclamp natin pag na to. We'll unclamp our tubing, and then we will be repeating the procedure as necessary, and then we will remove our gloves and secure the catheter tubing to the inner thigh and lower abdomen by anchoring the device or the tape. So, leave tayo po ng slack for our patients so we can move freely pa din. And then next is we will now assist the patient to a comfortable position. And then we need to drape also our client. So, to provide privacy pa din po sa kanya. And then we need to secure the drainage bag below the level of the bladder. And then also we need to place the bed to the lowest position, and then make sure that there is no kink, and then we need to check the drainage of our catheter. And then next is we need to remove the equipment and discard the receptacle, discard the materials that we use to the proper receptacle. And then next is we will now be removing our gloves, and if kumuha ulit tayo ng sample, syempre maglalagay po tayo ng gloves, and after that is we will remove our gloves and then perform hand hygiene. And the next is we need to assess our patient response to the procedure and the quality and amount of drainage after the irrigation. So we need to ask the patient if there is if he is feeling any discomfort, any pain during or after the procedure. And the next is our evaluation. We need to calculate the fluid used to irrigate the bladder and catheter, and then also we need to subtract the volume drained. And the next is we need to assess the characteristics of output, of viscosity, the color, the presence of clots, and observe the catheter patency. Of course, this procedure is used to maintain a patency of our catheter. So we should have done it correctly by always monitoring our patient's our client's catheter, if the drainage is properly working, or there is no any leaks or any kinks. Next is we need to refer the amount of solution that we used as irrigant and amount returned as drainage in the nurse's notes and the input and output sheets, because it is very important for the physicians to know what is the exact amount of the input and output of his patient and our patient. And then next is you need to report the catheter occlusion, sudden bleeding,